Cervical cancer is the sixth most common type of cancer in the world, and it is thought to have an incidence of 20 per 100,000 women every year. Now, cervical cancer is common between the ages of 45 to 55 and is usually rare beyond the ages of 20, which is why cervical screening such as the cervical smear is not routinely done before the age of 20. In terms of causes of cervical cancer, the most common cause is HPV, which is the Human Papilloma Virus, which can be spread through sexual contact. And the common subtypes for HPV are 16, 18 and 31. Usually we have what we call a tumor suppressor gene, the P53, that helps to suppress any growth of tumors. But what the HPV does is that the HPV oncogene now binds to the tumor suppressor gene, which encourages the growth of these cancer cells. Other causes of cervical cancer include smoking, STDs such as HIV, having multiple sexual partners, young age of sexual intercourse, because when you're quite young, your cervical zone is still transitioning, so you're more prone to having abnormal changes in the cervix. Also, if you had pregnancy at a very young age, as well as having 3 or more multiple pregnancies, all put you at risk of having cervical cancer. In terms of the symptoms of cervical cancer, common symptoms include what we call intermenstrual bleeding. This is when you have bleeding or spotting between your periods. So ladies, if you notice any bleeding or spotting before your periods, do not ignore the sign and see the doctor. Other signs include if you're already postmenopausal, which is you've not had your period for more than 12 months and you're experiencing bleeding after you've not had a period for 12 months, this is classed as a postmenopausal bleed and another reason to see the doctor. But one of the most common signs is postcoital bleed. This is bleeding after intercourse and it's quite common in 30 to 40% of women with cervical cancer. So if you're bleeding during intercourse, please see a doctor. Bleeding might be irregular at first, but then it might become continuous, but you don't want to delay it until it's too late. Also, any offensive blood-stained vaginal discharge is a sign that something's wrong with the cervix. Now, these are what we call relatively early signs. If we're talking about late signs, we're talking about heavy vaginal bleeding, abdominal pain, pelvic pain. You might feel that your abdomen is bloated or pelvic mass. You might experience weight loss. And an ominous sign is back pain, because back pain indicates that the cancer has possibly spread to your spine. So usually if you have these symptoms or signs, you see a doctor. Your doctor will do a basic examination, which includes a bimanual and speculum examination, which would involve the use of the fingers. And on some occasions, when the doctor touches the cervix bleeds very easily. Your doctor might also feel a pelvic mass in the cervix or in the abdomen. Now, during the examination, it's a good time to do a cervical smear if you've not had a cervical smear done. If this cervical smear is abnormal, this might prompt further investigation, such as a colposcopy, for instance, where a biopsy is also taken of the cervix. In terms of treatment for abnormal cervical smear, colposcopy and cone biopsy is done at the same time, where a portion of the cervix is removed for surgery. But again, this depends on the staging of cervical cancer. So you have different stages. You have stage 0, known as carcinoma in situ. You have stage 1, where the cancer is confined to the cervix. You have stage 2, where the cancer is beyond the cervix. You have stage 3, where the cancer has spread to the pelvic wall, as well as parts of the vagina. Then you have stage 4, where the cancer has gone beyond the pelvis and is now affecting the bladder and the rectum. So your stages of cervical cancer will determine the treatment, which, as I said, would range from colposcopy with a cone biopsy, or even having a radical hysterectomy, which would also involve removal of the lymph nodes, because cancer can easily spread through the lymph nodes to the bloodstream and affect other parts of the body, where you can get bone pain and other symptoms. This can also be followed by radiotherapy or chemotherapy, depending on what the right treatment of choice would be. So I hope you understood this video on cervical cancer. If you have any unusual vaginal bleeding, whether it's bleeding between your periods, bleeding after intercourse, bleeding after you've had menopause, unusual blood-stained vaginal discharge, any back pain, abdominal pain, bloating, weight loss, or any other unusual symptoms, please see your doctor straight away.